okay? What I want to know as I bring this leg up is whether you're getting any pain in your back, whether you're getting any pain in your bottom, whether you're getting any pain in your hamstring or your calf. So just let me know when you're starting to get some pain. So I'm having a feel of when this first point of resistance starts to come on for Sam, which is around here. So around sort of 35, 40 degrees. And then the second point of resistance where I can't take him any longer, which is more like 45, 50 degrees. So Sam's got some nasty tight hamstrings for us to deal with here, exactly. But certainly it's not his nerves that's restricting him. So what's really normal for someone is that your first point of resistance is going to be about 10 degrees before your second point of resistance. And I'm asking Sam all the time whether he's getting pain in his back, his bottom, or his hamstring when we're doing that. Now, when you're in this position and it's clear and it's the same as the other side, you might then add some dorsiflexion to it as extra provocation from a nerve test. So you're dragging that nerve a little bit further out through the foramen and seeing what sort of pain you get. Again, you're looking for a change in the low back and the glute and the hamstring, okay? If it's just changing the calf because you're stretching the calf, it's not a positive test, all right? But that's a pain provocation test. This first point of resistance and second point of resistance tells us a lot about how much tone is being held in the muscles that the nerve is dropping through. So, for instance, if Sam has a test that's exactly the same on both sides, 35 degrees is his R1, 45 degrees is his R2, I'm not really worried about dragging that nerve out through his foramen and getting a positive test, or his nerve having a contributing factor to his back pain. So when we think about what's happening, if Sam has a really big disc and we're doing this test, most likely he's going to have pain that comes on a whole lot earlier in range, okay, than what would be his other side, if you like, the test on the other side, okay? And that's because the nerve is coming up against the bulge in itself. But the other thing is that's a little bit trickier to work out is your range of motion might be almost the same on each side, but R1, so your first point of resistance might be a whole lot lower. And if that's the case, what I'm thinking in my brain is when we get discogenic inflammation, you also have a whole heap of inflammatory soup around the disc itself. And as you're stretching that nerve and taking that nerve out of that foramen and dragging it through that inflammatory soup, your nerve's irritated and it's saying, hey, don't like that. And the muscles that it's dropping through are holding some tone within them. So your glute and your hamstring in particular are holding tone. So if you've got R1 down at 20 degrees and your R2 is at 45, you know, that's a long way away from what it should be. It should be about 10 degrees between R1 and R2. Then I'm thinking glute and hamstring are holding tone. Why are they doing that? We're probably doing that because there's some inflammatory soup around that disc. What I'm thinking immediately with that is if Sam's already told me he's a bit stiff when he's getting out of bed of a morning, he's got an achy back of his overnight, I'm thinking that we're going to have to speak to the doctor or the pharmacist about getting Sam some anti-inflammatories to help settle this back pain. The other important part of this test is the fact that if your first point of resistance is a lot lower and the hamstring is holding a fair bit of tone, what's that going to do for the athlete going back into their sport? So for instance, Sam's not a rower, but if he is, we need Sam to be up at 70 degrees of a straight leg raise. And at the moment he hasn't got his hamstring flexibility to be able to do that. But certainly if he had 70 degrees on one side and only 30 degrees on the other, we're not going to put him back in the boat because he's got a hamstring that's upregulated in tone, not allowing him to use that range of motion in a free and easy way. He's probably going to be sinking back into more posterior pelvic tilt to take pressure off his nerve, which is going to flare his disc up even more. And that's not fair to return him to sport until that straight leg raise is what it needs to be for sport. If we think about a footballer that's presented with some discogenic back pain and we think there's an inflammatory component and he's got 70 degrees on one side and his R1 on this side is 40 degrees and his R2 is 70, he's holding a whole heap of hamstring tone without the back even being loaded against gravity. And if that's the case, we don't want to send him back out onto the footy field where he might need to bend over and pick up the ball with hamstring tone and predispose him to a soft tissue hamstring injury. So this gives us a really good idea of when the back is settled enough to start looking at a return to sport. So as soon as R1 and R2 are a long way away, we're thinking that we need some anti-inflammatory support to be able to help us settle this back, and this becomes one of our biggest asterisk signs. It also becomes one of the things that we're prioritising to try and settle down before we return that athlete to sport.